This is Tar Heel Talk, an in-depth look at the issues and people making news in North Carolina. Here's your host, Sonia Williams.
According to the American Heart Association, heart disease is the #1 killer of women, causing 1 in 3 deaths each year. That's approximately 1 woman every minute. On today's show, we'll take a closer look at women and heart disease. We'll hear from a local woman living with heart failure. Gladys Lundy has shared her personal experience for a national awareness campaign in this video produced for Women Heart, the National Coalition for Women with Heart Disease. Here's more.
I was getting ready for my wedding. I was preparing for my bridal shower, and I noticed I was short of breath. I had a little heaviness in my chest, and I felt like I had a lot of fatigue. But we thought it was the wedding jitters, and we thought that it was something that would pass. The heaviness in my chest, I felt like someone was sitting on me. So I'd been walking around for more than 3 weeks in heart failure.
I awoke to stuttering, and my equilibrium was totally off, and I knew something was wrong. However, I didn't do anything about it. Later on that day, they found me in the bathroom passed out. And it was at that point I was hospitalized, and the doctors informed me that I'd had a mini stroke. But the reason I had a stroke was because I had heart disease.
The leading cause of death for women in the United States is cardiovascular disease, and that includes congestive heart failure. There are several causes of heart failure in women, and they tend to occur at various times in life. There is a congestive heart failure that can develop during pregnancy or early after pregnancy. Another cause, the common cause of heart failure is myocardial infarction or heart attack. That can happen at any time of life to a woman. But later on in life, as a result of high blood pressure through the years, women can develop heart failure, which is related to thickening of the heart muscle. These women are generally older, and they're often underdiagnosed because they believe that at this time of life they should be fatigued, tired, short of breath, and that is often a group of women who are not diagnosed early with congestive heart failure when they could be.
I had to educate myself because I knew very little. I knew about heart disease because I'm a heart patient. I knew nothing about heart failure.
Damage to the heart muscle that results in congestive heart failure is generally a very global process. All chambers of the heart are affected, but sometimes the left-sided chambers of the heart are affected more than the right, and sometimes vice versa.
My right lung was completely full, and my left lung was almost half full. I always felt like I had a third person on me, like I was carrying somebody. Who would be laying at a table with pillows and sleeping and think that that's normal? But you think it's going to pass. I could not even shower by myself. It was hard. I couldn't breathe.
Sometimes heart failure can be very insidious, but the majority of people who develop congestive heart failure develop it over a period of days to weeks to months, and they may not fully understand that the symptoms are abnormal. Any kind of symptom such as fatigue, shortness of breath, chest discomfort, abdominal fullness, swelling in the legs, or sometimes even the hands, signals a change for which you should talk to your doctor. The most common causes of heart failure in the United States are coronary artery disease and hypertension. Patients with coronary artery disease often have had a myocardial infarction or a heart attack before developing heart failure. Other causes of heart failure include valvular heart disease, both leakage of heart valves and also narrowing of heart valves. And then we have causes that involve toxic substances such as chemotherapy for cancer, and then either illicit substances like drugs or even alcohol, when used in excess, can cause heart failure.
When my doctor and I sat and talked about what type of treatments that we were going to work with, I always like to know all my facts before I even get started. He was very concerned when I first came in and I was diagnosed. Biggest thing was to get the fluid off my chest, and then from there we would go.
The most important message about treatment of heart failure is that treatment of heart failure can restore heart function. And medications alone are sometimes the only therapy needed. Medications have really revolutionized the treatment of congestive heart failure in the last 2 decades. These medications can change the process that is result in abnormal heart function that is called remodeling and restore heart function. And oftentimes, with good medical therapy, cardiac function can be restored to normal. The majority of cases of heart failure can be prevented because the majority of heart failure is caused by high blood pressure, diabetes, high blood cholesterol, obesity, and smoking, which lead to cardiovascular disease. There are causes that are not preventable. In each of those cases, though, good treatment can result in great outcomes. The same things that we bring to prevention, such as keeping blood pressure under control, modifying risk factors, will improve heart failure outcomes.
It's a battle. There's a ton of fatigue, which I live with. When you get excited or anxious, that takes energy. If you're cold, that takes energy. And it's all a piece of it. Talking takes energy. It's the little things that are hard. So I balance. I try to look at what I can do. And if I have something big, I try to prepare for it.
Any patient with heart failure, just like any patient with any kind of heart disease, needs to quit smoking. And diet and exercise are very important. What is crucial in heart failure is the avoidance of high sodium foods. We advise patients to take in no more than 2,000 milligrams of sodium a day. That is a major lifestyle change for a lot of people, especially in the United States. Exercise is important as well. Many, many years ago, we told heart failure patients to go to bed and rest. That is no longer the case. Recording your weight daily is very important for patients with congestive heart failure because subtle changes in fluid balance can become evident with a change in weight. So we instruct patients to not only weigh themselves, but to notify us of a sudden change in weight, such as 3 pounds overnight, 5 pounds over 2 days.
Right now, I'm living. I don't let my condition stop my progress or stop me from doing the things I love to do. There's still life in this body, and I can still be a message for someone.
Cardiovascular disease and heart failure are hard diagnoses to be given and to own. But I think it's important for women to understand that they can survive this disease as well. It is a chronic disease, but with good treatment, long-term outcomes can be very good, and they should feel like they're survivors.
A lot of times there's a lot of people that think that once you go to the doctors, they're going to give you something and you're going to move on your way and it's going to be gone and it's going to be over with. You live with this disease every single day of your life. It's never gone, and there is not one pill that's going to fix it. There's not one exercise program that's going to fix it. There's not one diet that's going to fix it. What there is there's you managing your weight, you managing your diet, you managing and ensuring that you're taking all your medicines appropriately, accurately, timely. All these things, it's you. It's your responsibility.
Excellent information, two very powerful stories. And with us for the remainder of this show is Gladys Lundy, who was featured in the video. Gladys, in addition to living with heart failure, she's also the president of the Minority Women Health Project, an organization that provides education and support regarding heart disease and stroke to minority women throughout the Triangle. Gladys, we are glad to have you with us, and we're going to talk more with you and hear more about your story when we come back from this break. We'll be back with more Tar Heel Talk after these messages. Heart disease kills more women each year than all forms of cancer combined. February is Heart Month and the perfect time to raise awareness about heart disease in women. And with us here again to continue sharing her personal story is Gladys Lundy. Gladys is a longtime heart champion who is now living with heart failure. Gladys, thank you for being with us. Thank you for participating in that national video and just for working to raise awareness about women in heart disease.
Thank you so much for inviting me on the show to talk about heart disease and heart failure. We're recognizing now that heart failure among women is on a rise. And awareness is the key.
Absolutely.
Awareness, education, communication.
Help us understand the difference between heart disease and heart failure. Is it one and the same? What's the difference between the two?
Most people who have heart failure have heart disease of some sort. And heart disease encompasses several things: congestive heart failure and other areas of heart disease. However, heart failure is when the heart is no longer pumping well enough to supply blood throughout your body. And at that point, when that occurs, there has to be a whole lifestyle change and a whole management change of dealing with heart disease.
And you've dealt with heart disease for a number of years now. Take us back through briefly a little bit of your personal journey with heart disease.
You know, I thought I was very healthy. It was in 1999. I was 45 years old. I was on a business trip. I was the healthiest I'd ever been. I'd had a physical. The physical was normal. You know, you've heard after a physical, you get you have nothing to worry about, and that was what I believed. I was in Florida on business, and I woke up that morning and I recognized that something was different. I was stuttering, and I don't stutter. And I just tried to push it away and to continue my day. I was in Florida on business, and being sick was just not part of that agenda. And later on, during the course of the day, at some point I passed out in the bathroom. And when I recognized what was going on, I was hospitalized. And I was listening to a physician telling me I'd had a stroke. I had a stroke because I have heart disease. And that was a pill to swallow. Again,
especially
I thought
after
I
you've
was
been
very,
given
very healthy.
this clean bill of health with your physical. With that in mind, what should women know when they go to the doctor? What types of things, or in hindsight now, can you think of anything that you were feeling even before the stuttering that might have been a warning sign?
You know, in my case, I was asymptomatic. I didn't feel anything. I didn't know anything was going wrong. As a matter of fact, when I flew in that evening prior to the episode, I went running. So I was asymptomatic, but there are symptoms that women should be aware of when it comes to heart disease.
Because they are very different than what a man might experience.
Absolutely, absolutely. They're very different than a heart attack in a man. What we've learned over the years and what we've seen is men, when they have heart attacks, they are grabbing the chest and there's that great big old pain. It's like an elephant sitting on your chest, and they're falling all down. But those are symptoms for men, but not for women. In women cases, a heart attack can be exhibited by just something as pain in your back, or a pain in your jaw, or swelling of your extremities, or pains in your ankle, and nausea, shortness of breath. All those are symptoms for women.
And they can be symptoms of so many other things as well, which makes it probably even harder to recognize and then to diagnose as well.
So what we advocate is that if you begin to experience any of those symptoms in a way that you have never experienced it before, and you know what your body norm is, we recommend that you take that time to be examined.
And I understand that physicians are now becoming more aware and more in tune with the symptoms for women, because I know that there was a time where if you didn't have the pains in your chest and some of those traditional symptoms that men have, doctors would often say that it was something else.
Overlook it. And please, I don't want to send the wrong message out based on what you just said, because yes, that's true. Doctors are more aware. However, we're going into hospital settings all across the country, and we're recognizing that our women are still being sent home, and their heart disease or their heart symptoms aren't being diagnosed. So it's up to you as an individual to be consistent, to be very vocal. If you still are having those same symptoms that you came into the hospital with, and you're leaving the hospital and you have not been diagnosed with what you perhaps thought it was, heart disease or whatever, then it's incumbent upon you to say, I still want to be seeing more. You have to become your own manager of your health in a sense.
And your own advocate.
And your own advocate.
Absolutely, absolutely. And it's important for women to know those symptoms. Like you said, education and awareness are so important because we have to take care of ourselves so that we can take care of everybody else like we always do.
1 out of 3 women dying from heart disease, 1 out of 3 women experiencing health issues as a result of heart disease, disability. Those are staggering numbers. Those are very large numbers. What we would like to see is those numbers begin to fall, not to increase. So heart awareness is very important. We're so happy that President Obama named February as Heart Awareness Month.
Right.
So you're probably hearing a lot going on about Go Red and women and heart disease and knowing the signs and knowing your symptoms.
Right. And people can find out more details about those signs and symptoms by going to the National Coalition for Women with Heart Disease. Their website, lots of information, womenheart.org, or they can call the national hotline at 202-728-7199 and certainly find out more information about the different signs and symptoms that are unique to women. Gladys, we're going to take another break. We'll talk more in just a minute.
Okay.
We'll be back with more on women and heart disease after these messages. Welcome back to Tar Heel Talk. I'm Sonia Williams. According to the American Heart Association, heart disease is the #1 killer of women, causing 1 in 3 deaths each year. That's approximately 1 woman every minute. On today's show, we're taking a closer look at women and heart disease through the eyes of a woman living with heart failure. With us again is Gladys Lundy. She is also the president of the Minority Women's Health Project here in Raleigh. And we thank you so much for being here and just for sharing your personal experience and how you're working to educate more women across the Triangle and around the country about women and heart disease.
We recognize, one of the things we like to say is that the other component to good health is good education.
Absolutely.
So it's more than just sitting down with your physician. It's sitting down with your physician, taking what he gives you, and then moving on to the next phase of you taking control and making changes in your life. We mentioned the National Coalition for Women with Heart Disease, and I just really want to just tell a little bit about that.
Okay,
It is a national, the only national organization addressing women with heart disease. We represent over 8 million women in this country living with heart disease. We're based out of Washington. And if you've never heard of us, go to the web. It's www.womenheart.org. We have a local group here in Raleigh called Raleigh Woman Heart. And I think this information will be going up.
Absolutely. That's a part of the Triangle, the Minority Women's Health Project
we
as
work
well.
Closely with the minority, yes. Yes.
So there's that local support here. You're talking about that education component when you have people who can gather on a regular basis, as you do with the Minority Women's Health Project. You're meeting every 4th Thursday?
We meet every 4th Thursday here in the Raleigh area from 10 till 11 at one of the local churches. And I think that information will probably be going up as well.
And
but information about the organization should be there as well.
And that number is 919-264-8120. And they can contact the group by email, minwomen@hotmail.com.
Correct.
And certainly find out more information about the support groups, the meeting times. There's a lot of education that has to go on. I know we talk about this a lot during the month of February, but really women are dying every day, every minute from heart disease. So we can't talk about it enough.
To speak on our own behalf and to develop a relationship with whomever you're seeing as your physician. And I say this to all women, if you have not taken the time to have that talk with your physician about you and heart disease, now is the time. Do not let this another moment go by without scheduling an appointment to talk about heart disease with your physician.
What are some of the risk factors? I know that you said that you were asymptomatic, but do you have any of the other risk factors or risk factors that go along with heart disease in women?
Well, see, there are many risk factors: obesity, sedentary lifestyle, smoking, alcoholism, diabetes, high blood pressure, genetics. They're the ones that we cannot affect, like age, race, genetics. But the other ones that we can, we need to make changes. If you smoke, stop. If you drink excessively, stop. If you have diabetes, stay within your norms, know the numbers. We often say that there is no reason for women not to know your numbers, your cholesterol level, your blood pressure level, what your weight level should be, your BMI.
Right, that healthy body mass index is extremely important.
Yes.
And I know a lot of times some people think, well, maybe that's a vanity issue, but no, it's really a health issue because it can impact so many other parts of your health and your body. So it is important to know those numbers. When you know those numbers and you go and have a conversation with your physician, what are some things that women should really advocate for?
Talk with your doctor about what you need to do to stay heart healthy. Get him to help you develop a heart healthy plan for you, whether it's diet or medication or exercise. But first of all, when you schedule that appointment with your doctor, take the time, write down some questions, and do not leave his office until at least he'll address some of those questions. You know, that's something we also advocate. Be prepared.
Right.
When you go in there with an agenda.
As you continue to speak out and share your personal story, what is on the horizon for you? How are you feeling and how are you doing right now?
I am fine. I'm feeling fine. This is an adjustment for me. I have had to make a whole change in the way I do things as far as medication and exercise and just living. Down the line, one of the things that I learned when I was diagnosed with heart failure was that I am in advanced heart failure. And there are so many different stages. I think American Heart Association and American College of Cardiology have various stages, and then there are other numerical stages, but one would say I'm in stage 5 heart failure, which basically means that at some point I will need a transplant. And that was a hard pill to swallow when my husband and I were told that I would be in need of a transplant. But not right now, you know, so that's even more important. It's not right now, so.
Well, you're looking fabulous, and we certainly thank you for taking the time to share this very important information with us. We wish you all the best, and we're praying for you and with you that everything works out just fine, and we certainly want to just thank you for being here. We're out of time, but we want to tell people if they want to find out more information about women and heart disease, go to womenheart.org, the National Coalition for Women with Heart Disease, and there's lots of information there. Gladys Lundy, thank you so much for being with us. That's it for this week's Tar Heel Talk. To comment on this or other episodes of the show, send us a message on our Facebook page or an email to tarheeltalk@fox50.com. I'm Sonia Williams. Thanks so much for watching. Enjoy your week.